Hey, everybody, it's Jody. This is not a full episode of the podcast. I'm working on a really cool interview that I can't wait to share with you that I should be done with here in the next week or two. But in the meantime, I wanted to comment on this situation with the ACIP, the Advisory Committee on Immunization Practices, the New England Journal of Medicine interviews podcast that came out this past Wednesday, which would have been July 30th. They interviewed Jason Schwartz, who's an associate professor in the Department of Health Policy and Management at Yale. And they had a good conversation about this situation where a couple of months ago, the Secretary of Health and Human Services, Robert Kennedy, fired all 17 of the current members of the ACIP with the intent of replacing them with ostensibly people who share his views about vaccines. There's actually an executive order on this from President Trump, came out at the end of May 2025. The title is Restoring Gold Standard Science. It's too long to read, but I'll put a link to it in the show notes if you'd like to check it out and get all pissed off. It basically says that under the Biden administration, everything got screwed up and nobody trusted the leading scientists anymore. And this administration is going to fix it. So what is the ACIP? This is a group under the CDC. It was established in 1964 as part of the Public Health Service Act. And this is the Federal Advisory Committee that develops recommendations on vaccine use in the civilian population in the United States. CDC uses their recommendations to set immunization schedules for adults and children. According to their charter, they can have up to 19 committee members who are considered special government employees, and those people are supposed to be, quote, knowledgeable in the fields of immunization practices and public health, have expertise in the use of vaccines and other immunobiologic agents in clinical practice or preventative medicine, have expertise with clinical or laboratory vaccine research, or have expertise in assessment of vaccine efficacy and safety. The committee shall include a person or persons knowledgeable about consumer perspectives and or social and community aspects of immunization programs, unquote. There are 6 other people that are members of the committee but don't get to vote. Those are representatives from the FDA, CMS, NIH, Indian Health Services, and the Office of Infectious Disease and HIV/AIDS Policy. There are non-voting liaison representatives from really all of the professional medical organizations. I'm not going to read that list because it's pretty long. And they're supposed to meet 3 times a year to talk about vaccines. The order to reconstitute this committee came out on June 9th, and then they had their most recent meeting, which was on June 25th. And that was with the new members of the committee. If you're interested, you can see their agenda for that meeting and actually live stream videos of the meeting on YouTube. I'll link to an NPR article that came out on June 25th about who some of the new members are. It's probably pertinent to remind everyone that NPR just got a bunch of funding cut by the administration. Actually, we just learned in the last couple of days that the Corporation for Public Broadcasting is going away because of the loss of funding. So anyway, there's 8 new members on the panel. And as you might expect, there is some question about their qualifications and their attitude about vaccines in general. This article gives an example of Retsef Levi, who's a professor at MIT, has posted on social media that COVID vaccines are killing people and must be stopped. Another new member, Dr. Robert Malone, is very critical of mRNA vaccines in general, even though he actually worked on some of the early research into that technology. Evidently, he thinks that COVID vaccines cause cancer. Martin Kulldorff is the new ACIP chair. He is an epidemiologist and biostatistician who used to work at Harvard. He and Dr. Malone, I guess both have been paid expert witnesses in litigation against a drug company. So the concern is that they've put a bunch of people who either don't know anything about vaccines or just generally anti-vaccine on this committee, which is exactly what you would expect from Robert Kennedy. There's been a pretty big outcry from all of our professional organizations about this. There's an article on the National Foundation for Infectious Disease website that has a summary or a list of a bunch of position statements about this from all the professional organizations. Starting alphabetically, you got Alliance for Aging Research, American Academy of Family Physicians, American Academy of Pediatrics, American Academy of Physician Associates, American College Health Association. It's a long list of organizations like that who have all come out very strongly against them doing this, which I appreciate. And yes, there are nurse practitioner organizations on that list, the American Association of Nurse Practitioners. That statement was also undersigned by a bunch of other nurse practitioner associations, and then the National Association of Pediatric Nurse Practitioners put out their own statement. So yeah, we're in there too. Pretty much the gist of the New England Journal of Medicine podcast episode was that moving forward, we probably ought to look to these professional organizations for guidance on vaccines. So this puts me personally in a weird position, or at least it makes me feel weird. I guess I'm an institutionalist. I try to go by legitimate evidence-based guidance and recommendations from the healthcare authorities when I'm trying to figure out what to do for my patients. I trust the CDC and the FDA and the USPSTF and all the other acronym agencies that put out guidance on what we're supposed to do. I don't work for an institution. I work for one individual physician. And being out on our own like that, we don't have institutional policies and procedures and committees of people to tell us what we ought to be doing. We just have to use our own judgment and figure out what the right thing to do is. When I worked at the hospital, it was always kind of reassuring that as long as I was following the facility's rules and policies and whatever, then I was likely doing the right thing. And it was up to them to figure out when the rules should change. But that's not the case anymore. So I just have to decide who I'm going to pay attention to. And the whole vaccine thing, my goodness, has been such a mess ever since COVID. I've never quite understood why people got so upset about all that. And maybe it's different in other parts of the world, but where I live, I'm going to say a big majority of my patients are super conservative and we're not crazy about the whole vaccine situation during COVID. And now I feel like that has generalized out to where a lot of people are like, you can forget it. I'm not getting a vaccine. In fact, I've even stopped asking my patients directly about COVID vaccines. I'll go through the rest of them individually, but I just don't want to hear it. I don't want to get yelled at about it. I don't want to hear the conspiracy theories and I just, you do you. I personally am a vaccine person. I want every vaccine I can get my hands on. I want it in my arm, please, right now. Never had any problem with a vaccine. For the most part, I've never gotten any of the diseases that one gets vaccinated against or one should get vaccinated against. Obviously, that was not true with COVID, and maybe that was part of why people bucked against that so much. Same kind of situation where if somebody gets a flu shot and then ends up getting the flu, good luck ever getting them to get a flu shot again. So when I'm talking with my patients, I try to just sort of be impartial. I try to just let everybody know what the recommendations are. And if you want to get a vaccine, great. And if you don't, that's your choice. I will say it did bother me back during the pandemic. There was a brief time where they decided that they were going to require federal employees and contractors to be vaccinated. And as much as I thought everybody should have gotten vaccinated, especially during the middle of the pandemic when it was raging and people were dying, it made me kind of uncomfortable when they started trying to force people to get it. At the end of the day, in the United States, you should not be forced to take any kind of treatment that you don't want. That's kind of a basic tenet of our healthcare system. And I didn't like that at all. It weirded me out. So that's where I stand on vaccines in general. The question now is, how am I going to figure out what to tell my patients moving forward? I personally don't trust this whole administration, this whole situation. I don't trust it. I don't like it. And I'm going to be very suspicious of any vaccine recommendations that change or that go away or that come out while this group of folks is in charge. But I just said I trust the organizations, and I always have. So me saying that I don't like the recommendations that are coming out based on which administration is in charge kind of makes me just as much of a wacko as the folks who were saying they wouldn't get a COVID vaccine because Joe Biden told them to, right? It's sort of the same thing, just the mirror image, right? Just from the opposite side. In my mind, it is different because I think these people are wackos, but that's my personal opinion, right? So far, I don't think there's been a situation where they have made some recommendation that I have to choose whether or not to go by. And when that happens, it's going to be quite the dilemma for me and for a lot of healthcare people, I suspect. I'm trying to figure out what my message is here. And I guess the message would be pay attention to where you're getting your information from, which is always good advice. It always seems prudent. I think it's especially important right now for us to actually pay attention to the news and the government and what's going on in the country. I found myself putting my head in the sand for a period of a few weeks there. I just got to where I felt like I couldn't pay attention to it anymore. It was just bringing me down too much, the whole situation. So I just stopped paying attention. I just tuned out. I'm easing back into it now. I'm listening to more of my political podcasts and more news and trying to find the right balance of paying attention and being informed, but not being consumed by it. All right, so there you go. There's your current events update from Knowledgeable Provider. I'll be back soon with a full episode. Thanks for listening. Special thanks to our Patreon supporters. I hope you all have a good week, and I'll talk to you later.